And now it's time for this week's ICO Spotlight. This is where we will introduce you to a company that's planning to launch or has launched an ICO. In today's ICO Spotlight, AMCHART by AMCHART Group. AMCHART is a universal electronic health record that's poised to change the way we access patient and provider records. It utilizes blockchain technology to eliminate the current problems with record systems. Taking a closer look, their pre-sale's already underway with a general public token sale starting March 1st. I caught up with Chairman and CEO Ken Park at the World Funding Summit in Los Angeles. Take a look. Hey everybody, it's me, Adam Chapnick, here again with ICOinvestor.tv. Thanks for joining us. I am super excited today because I'm here with Ken Park from AMCHART Group. He's the chairman, and they have been around for a long time, unlike a lot of the companies that were talking to us lately. But they have their hands in all kinds of interesting things, and it's really exciting to be able to talk to you today about all the stuff you're doing. Thanks for joining us.
Thank you, Adam, for the interview.
Right on. So tell us, first of all, about AMCHART and how maybe you started it and what it does now.
Sure. So AMCHART Group was started 15 years ago by my flagship company, AMCHART Innovative Solutions. We are an IT services company. I started AMCHART Innovative Solutions 15 years ago with $100 in my pocket from my house. And today we are going to be, a cumulative revenue across all our group companies are going to be about $100 million. So no debt, no VC, no bank loans. It's all our money. My money, and it's just we are continuing to put the money back into the ecosystem so we can create more jobs. We have 1,300 engineers working for us on the AMCHART IS side, but then we have, I don't know, another 100 employees in India. We have a bunch of healthcare people working for us. So the goal over here is to continue with the American economy and grow it where we can continue to hire good American workers.
Fantastic. So that is quite an accomplishment. Congratulations so far. And particularly interesting to us is that you've got some really exciting insights into how blockchain can help what you're already doing and then maybe more importantly help the world. What have you got in your cooker?
Absolutely. So earlier this year, it's been 6-9 months in the making, we got on Dr. Aman Quadri, who is a PhD, has a master's, and he has been in tech before, went into healthcare, now he's already back in tech. And we made him the CEO of AMCHART Blockchain. And AMCHART Blockchain, along with Choka Palamkuttai, who is our CTO, he's a super wicked smart guy. They're very rare, good experienced blockchain programmers who have multiple years of experience, and Choka is one of them. And he's our CTO. So both Aman and Choka and I, of course, have come together, and we have embarked the journey on AMCHART. So it's amchart.io. And what AMCHART is we are going to create the first universal medical records on a blockchain. What that does is, I'll give you an example. You go to a doctor's office in Ohio, they have your medical history. But let's say you come to my hometown, Texas, for a Texans game, and you have to go to the ER or doctor's office. Well, they don't have your medical history, so they might give you medicine that you might be allergic to. Did you know that 79% of medical malpractices happens because they treat you for something that you did not have, or they gave you incorrect medicine because they did not have your complete medical history? So, AMCHART is going to change that by we are creating electronic health records on the blockchain, which any consortium that accesses the blockchain, whether it's doctors or medical record people or whoever it is, can have access to your medical records. The way it does is they can access your hashtag, you give them the private key, and they have access to your deal. We are in our board for AMCHART. We have Andrew Casas, who is the COO of UT Physicians. They have close to 2,000 doctors working in the UT Health System.
That's University of Texas.
University of Texas Health System. And they are super excited about this project. And not only just in America, but we are trying to do this is universal. Blockchain is a decentralized universal platform. So if you go to Dubai, or if you go to India, or if you go to Japan, or wherever you go, if the doctor's office can do a QR code, read your hashtag, they have instant access to your health record. And that's fantastic. That's power. That it's like you'll have an app on your phone. You basically tell them, hey, just read my QR code, which has your hashtag of your medical records. You give them the private key, and boom, he has access to all your medical records, your images, your blood test, the whole 9 yards.
Yeah, definitely the electronic medical records and decentralized, or sort of putting them all in the same sort of intelligence network is obviously the future. Is there any kind of challenge with competing sort of platforms, or will anybody else who's doing this, will they be able to communicate together, or what's the competitive situation?
So yeah, it would be foolish for us to say over here that we are the only company out there who is doing a universal medical records on a blockchain, right? I mean, there have been a couple of companies out there who have tried, but those companies either have doctors in doing this, or either they have the tech guys doing this. But AMCHART, AMCHART, we are a combination of doctors, we're a combination of engineers that are really coming together to solve a problem. But I'll give you an example. So Epic is an EMR software that most of the hospitals use. Just to integrate a one-way integration from Epic, Epic wants you to pay them $500,000 for the integration. Now that's ludicrous, right? Nobody's going to do that. So what we have done is we have created this blockchain where we can have everybody's medical records on it, and then we are working with different consortiums, of hospitals and agencies to access their health records, on the same platform. If another blockchain healthcare company wants to team together and create a bigger records, hey man, let's go for it. Because the idea is that we are in profit, but at the end of the day, if we can solve the problem of, like, if we can save one patient's life by making sure that the medical records were right there on time, I think we've solved, we've done something. So if I can have other people come together and work with us, then that's fantastic.
What about one of the cool functions of some of the currencies, the tokenization of things on a blockchain, is it creates an incentivization sort of structure. Is that something you're going to include so that people are incentivized to include their records somehow in your? You're
absolutely correct. You know your stuff. So AMCHART.io, where we're launching our ICO January 15th, people can go and participate. So if you go over there, we have delineation of funds, and if you 10% of the tokens are reserved for patient rewards. So Adam, if you want to put your health record, online, you put your health records online, we give you a token. You maintain your health record with latest data, we give you a token. So it's a reward-based system. Same way, if let's say, LA's hospital wants to access your medical record, we'll charge them a token to access your health record because they're also billing your insurance companies. Imagine the fraud that is going to change from the healthcare companies. So there are a lot of doctors who bill Medicare and insurance companies for billing for procedures that they don't even do. They just have patient's name and social security number and their insurance information, and they bill them. Well, with the blockchain, the insurance companies can go verify the block to see, hey, did Adam really go to this doctor? Hey, did Adam really, get something done to himself, right? And that's the most important part. So this is not going to not only save lives by making sure that the medical records are there on time, but will also save so much of fraud, and it's going to save billions of dollars in healthcare cost.
Wow. So this is another use of the blockchain as an efficiency driver. It's just a fascinating way to incorporate the incentives on the patient and the making everything cheaper. It's really visionary. So thank you so much for joining us to tell us about what you guys are up to, and I'm sure we're going to see big things from you and your companies in the near future.
Thank you.
Thank you.
Thank you. Appreciate it, Adam.
AMCHART's public token sale begins March 1st. You can find more information at AMCHART.io. And a reminder to our viewers, you can learn what ICOs are all about on our website, icoinvestor.tv. Be sure to visit our ICO Learning Center, the Global Regulatory Review page, and much more.
In this week's Investor Spotlight, we're introducing you to another fresh perspective on the crypto world. Get ready to meet Jor Law.
Jor is a lawyer here in Los Angeles and a founding shareholder of Homeyer Law. He has an extensive background in the ICO and crypto world. I sat down with him at the World Funding Summit in Los Angeles, and he provided a lot